Yes, thank you. My name is Morgan Roupret. I'm a full professor of urology at Sorbonne University in Paris, France, working in Pitié-Salpêtrière Hospital in charge of the onco-urology department there. BCG has been there for a long time already. It is the gold standard treatment in the EAU guidelines, but adjuvant treatment after endoscopic surgery. We should bear that in mind, that surgery is a key step in the treatment of these patients. The question we have today is whether there is a part of the population of patients who are not responding to BCG who should be considered for other treatments. And it is true also that there were shortages in the production of BCG, and we had difficulties to have the quantity and the volume of BCG we had initially 10, 20 years ago. So we are considering new drugs or alternatives, but not to replace, but to challenge BCG.